Hello, my name is Rashma John, and for my CILE project, I'm going to be investigating the effect of COVID-19 on vaccine hesitancy in the United States. And these are the foundational and track competencies which this project is going to be fulfilling. Now, first, what exactly is vaccine hesitancy? It's defined as the reluctance or the refusal to vaccinate despite an availability of vaccines. Now, this is not a new concept. In fact, vaccine hesitancy has actually been present since the introduction of the smallpox vaccine back in the 1800s by Edward Jenner, but recently has been on a rise, especially in 2019, where it was deemed as one of the top 10 threats to global health. UNICEF deemed that between 2019 and 2021, 67 million children were missing at least one major childhood vaccination, deeming it one of the greatest backslides in childhood immunizations in 30 years. Now, why exactly 2019? Well, 2019 was the start of the COVID-19 pandemic, which not only wreaked havoc on the health of those worldwide, but also brought to mind a lot of attitudes regarding vaccine hesitancy and a reluctance to get vaccinated, which brings to mind my research question, which is, what are the most significant factors of the COVID-19 pandemic that have contributed to vaccine hesitancy in the United States? For the purposes of this project, I decided to employ a narrative review, which is an effective way of providing an overview of a subject matter, also allowing you to investigate the relationship between different variables. And for this narrative review, I decided to employ the PubMed database as my major source. And regarding looking up articles, my inclusion criteria including articles that were focused on vaccine hesitancy rather than resistance, articles that were focused during or post-COVID-19, specifically between 2020 and 2023, that were based in the United States and were full text articles. Any articles outside of this criteria was excluded. Now, first, I had to find a pool of articles to use for my project, which named this initial search. So first, in the PubMed database, I used search terms like vaccine hesitancy post-COVID-19 to come to an initial group of 278 articles. After excluding articles that were not in full text, taking place outside of 2020 and 2023, as well as outside the United States, that gave me an initial pool of 212 articles. From the 212, I wanted to determine the major themes that were associated with vaccine hesitancy and COVID-19. So I divided up the articles into various folders to determine these themes. And the folders are as follows: political affiliation, socioeconomic status, demographics, media portrayal and misinformation, health insurance coverage, medical mistrust in minority groups, lack of knowledge of vaccine efficacy, unknown adverse effect profiles, and religious beliefs. And the top three themes were political affiliation, media portrayal and misinformation, as well as medical mistrust in minority groups. From those themes, any articles that were outside the scope of COVID-19 are presented as a review or editorial were excluded, leaving me with 20 articles for this review. Now, in regards to political affiliation, it was generally found that Republicans were less favorable to get vaccinated, as well as less likely to support a vaccine mandate. They were, among those who were vaccinated, Republicans were more likely to report adverse effects compared to Democrats and more liberal parties. And Republicans were also more likely to believe the pharmaceuticals were uninterested in their health, particularly prioritizing profits over health, which is also tied with a general skepticism of science and government that was found in the Republican Party. Now, Democrats, which are generally more liberal, found that were more likely to get vaccinated, and this was tied to an increased perception of the threat of COVID-19 and how getting vaccinated could be potentially life-saving. And that was tied to specifically the type of news that Democrats were also exposed to, which we'll talk about next. Now, in regards to media portrayal and misinformation of COVID-19, I looked specifically at the way in which social media and major news sites and resources like newspapers and major news networks portrayed COVID-19 and how that affected vaccine hesitancy. In regards to social media, it was found that users of TikTok, Snapchat, and YouTube were less likely to get vaccinated, while those who use Facebook and Twitter were more likely. Regarding news, those who watch more conservative websites and news sources like Fox News were less likely to get vaccinated, while those who read the New York Times, Washington Post, and Wall Street Journal were more likely to get vaccinated. In regards to misinformation, a general theme was that the more increase there was in misinformation, there was a decrease in daily vaccination rates. And this misinformation came in the form of fringe opinions, foreign bots from Russian parties who were seeking to destabilize the politics of American government, as well as trusted sources such as physicians who were spreading misinformation about the use of ivermectin, for example, as a treatment for COVID-19 to sway people to use their sources rather than going to get vaccinated. And finally, regarding medical mistrust in minority groups, it was found that this medical mistrust was highest among Black Americans. They were found to have the highest MMI score, which measures mistrust at the interpersonal level. They were found to have the highest rejection of participation in vaccine trials. And this was all rooted in generally historical roots of racism, as well as a suspicion of healthcare industry in general that stemmed from major events such as the Tuskegee syphilis trial. In regards to trust level, it was found that minority groups in general were much more trustful of social workers and healthcare professionals rather than the federal government and the president in general as well. And this is a table which summarizes the major findings as well as conclusions of each of the studies, as well as the associated theme. Now, in regards to political affiliation, as we demonstrated, Democrats were more likely to get vaccinated while Republicans were not. However, there were some exceptions in the study. It was found that minority Republicans, as well as elderly Republicans, were actually more likely to get vaccinated because of the increase in immunocompromised state of the elderly, as well as the fact that minority Republicans were more likely to sustain the negative consequences of COVID-19 compared to their white counterparts, as seen in Mississippi, for example. In regards to media portrayal and misinformation, it was found that there was a tie in relationship between the political party in which one identifies with and the news in which they consumed. We also found that fringe opinions, foreign disinformation, risk news of the vaccine, and physician misinformation were all contributory factors of misinformation that was found about COVID-19. And regarding medical mistrust in minority groups, much of this mistrust was historically rooted in racism, like Tuskegee as well as slavery. Hence, minorities were more hesitant to get vaccinated and less likely to participate in clinical trials due to this history. However, there were exceptions to this rule, such as when minority groups were presented with the safety and efficacy of the vaccine through research and evidence, they were more likely to get vaccinated and more open to the idea of getting vaccinated. Now, some key recommendations include minimizing the skepticism regarding vaccinations in general. In regards to politics, one way to circumvent this is by employing the health belief model, which prioritizes health over politics and deems the individual characteristics that can lead to preventable diseases. Also, encouraging more collaboration between public health and scientists and conservative leaders could be beneficial in order to help conservative leaders see the benefits of vaccinations and spread that information to their constituents. Regarding media misinformation and portrayal, potential idea is that the government needs to take more control and mandate the removal of anti-vaccine rhetoric. However, this is a controversial take because of the freedom of speech in this country, but in some cases may be beneficial in order for the overall health of Americans. Now, in regards to medical mistrust in minority groups, transparent communication is key, especially regarding how clinical trials are created and run, as well as how vaccines will be distributed across the country. In addition, collaboration with community leaders and funding for culturally sensitive vaccine programs could make those who are initially hesitant more open to getting vaccinated. These are the references which I used in my literature review, and just want to thank you so much for listening to my presentation. Have a good day.